We have a candidate actually locally. This is an important congressional race in the 18th Congressional District. Obviously this is a partisan event. We're the Democrats here today. We're a Democratic Party. We're part of a national platform movement, and we support those emerging candidates on the Democratic ticket who are willing to embrace the philosophy and the principles of single-payer national health care, and that's very critical. So to just welcome, for a very brief comment, Steve O'Donnell here.
Senator, thank you very, very much for that warm welcome, and I will be brief. It's a real pleasure to be here and to speak before you. I wanted to start by sharing a story with you, one that happened not too long ago. I was walking through a building one day, and I had become lost, and this young woman was very kind enough to guide me to where it was I was going. And as we were going down the way, she was clearly uncomfortable, not feeling well, and when I asked her what was wrong, she said that she had had a very, very bad toothache. And I said to her, why don't you go to the dentist and have it taken care of? And she said, well, I don't have health care. The irony of that little vignette is that she was a nurse and we were walking through a hospital, and she was an employee of that hospital. Probably more than any one single event that epitomizes why, in my judgment, this system is so badly broken that it cannot be repaired. It needs, and we need, a dramatically different system, and it must replace it. And I'm here today to speak about universal, single-payer, not-for-profit health care. How is it that in a country with a $14.3 trillion gross domestic product and a national budget in excess of $3 trillion, how is it that we have over 47 million people without health care? How is it that we have 18,000 Americans dying every year because they don't have health care? How is it that in the United States of America, we have the shortest life expectancy and the highest infant mortality rate of any country in the in the industrialized world? And here's the kicker. Here's the kicker. We pay more per capita, per person, than any other country in the industrialized world. You know what? As Americans, I believe that we all want just a few things in life. We want a decent place to live. We want quality education for our children. We want the ability to retire with dignity. And we want a health care system that meets the basic needs of all Americans. If I'm elected to Congress, I will be a strong advocate for and help Congressman Conyers pass universal, not-for-profit, single-payer health care. I will advocate for a health care system that is affordable, that allows us to choose our hospital, choose our physicians. I will advocate for a health care system that addresses the mental health needs of our community, the drug and alcohol addiction needs of our community. And I will advocate for a system that takes care of preventive care, dental care, and far more. I'm going to advocate for a health care system that addresses the needs of the aged as well as the newborn. A system that's not driven by where we work, but by what we need as individuals. We absolutely cannot accept a system that discriminates against individuals based on pre-existing conditions. If I'm elected, I'll fight for a nation that invests in health care of the future and then delivers it to everyone. And all of this, by the way, is in our grasp. If we replace those in Congress like Tim Murphy, who doesn't understand that we can't leave 47 million people behind. And all of this is within our grasp if we elect people who will support the visionaries like the Congressman Conyers, who will move and advance health care for all Americans. Thank you very much. I appreciate it.
Thank you, Steve. I know the Congressman needs an ally. You know, a couple weeks ago on the 43rd anniversary of the passage of federal Medicare, we had a wonderful party with folks. 400 people came. And it was kind of funny because a group of delegates, some seniors, some Democrats, some Republicans and independents, quite frankly, left the event to take the birthday cake to the Congress people that didn't show up to celebrate the importance of Medicare and how it relates to single payer. And unfortunately, when they went to Congressman Tim Murphy's office, they were shut out. They were told it's a private office. I've never heard of such a thing, that we're paying for a public office. Again, I have 3 offices. You're welcome to come to my office night or day on Butler Street or up in the Natrona Heights or in Harris. But I've never heard of a congressperson saying it's a private office. That's news to me. But in any event, maybe Tim Murphy will get the message here today.